Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Okay, everybody, we are back on Healthy Living Tuesdays right here. Dr. Jitka Lom is nice enough to continue our discussion on asthma. Now, of course, we talked about what asthma is and possibly how you can get it. Now, doctor, you ready for the questions? We asked these on our Facebook wall. People sent a lot of really good questions, and they have some very specific cases. So, you ready to go?
Yes.
All right, so here we go. Gentlemen, if you will, please. Our first question comes to us from Jennifer Gogui, who sent us this question. This is an interesting case, Dr. Lom, because she says, is it safe to exercise if I've got asthma?
It really is safe, and it's really important, Jennifer, because you need to maintain your cardiovascular fitness. There are Olympic athletes and marathon runners who have asthma, and they've managed it, and it hasn't held them back. It's just really important that you be aware of your disease. Hopefully you have a prescription for some inhalers that you can use even prior to exercise. Especially in children, this is really important to use 2 puffs of your inhaler about 20 minutes before you exercise to keep those airways nice and open so that they don't twitch shut when you exercise.
And just so everybody knows, can you get these inhalers over the counter, or are they?
No, they are prescription. Yes,
okay.
They
All right,
are.
good tip. Okay, question number 2 comes to us from the Central Village of Talampago, and this comes from Chris. And Chris asked Dr. Lom, are there lifestyle habits I may change to get some asthma relief and reduce my risk of an asthma attack? We talked about this before we went to commercial, but Chris seems to be saying, what can I do right now?
Sure. So again, avoiding triggers, making sure that your allergies are well controlled, keeping your aircon really clean, don't be around smokers, don't burn things in your backyard, and wash your hands so you don't get sick. And then there's one other thing you might just consider, which is whether you have heartburn, because sometimes heartburn can trigger your asthma as well. So you would want to manage that and make sure that you control it.
That's interesting. I was not aware of that.
Yeah, especially when people lie down at nighttime, their acid reflux will travel all the way back and then go down the wrong way into their windpipe and trigger off asthma.
If you are asthmatic, is there a preferred way of sleeping, like on your back, on your side, on your stomach?
You can actually raise the head of the bed a little bit with little blocks under the foot of the bed, not with pillows, but just raising the entire bed so that it's on a slope. That sometimes does help people sleep better. Okay,
good to know. Question number 3 comes to us from Vicky Napoti, who posted on our Facebook wall. Dr. Lom, what is a peak flow meter?
Right, so there is a device that you can buy over the counter called a peak flow meter, and it will help you manage your asthma because it will tell you what your baseline is. It's hard for us to gauge how is my breathing today, compared to yesterday, compared to this morning. And this is an objective way to measure it. So it's just a tube, you breathe as hard as you can through it, and it will register a number. And then when you're having an asthma attack, you can compare your number to what your baseline is when you're doing very well. And that can give you an idea of whether you need to use your medicine more or whether you're doing fine. And there's also sort of a red zone where if you're really having problems, then it's time to go to the hospital and get help.
Is this kind of like the breathalyzer device that our friends at the police department use?
It's a similar looking device, yeah. It has numbers on it though.
Okay.
Yeah.
All right, so our next question is from Dedo, right up the street from us. And Josephine A. asks, do asthma medicines lose their effect if taken for long periods of time, doctor?
Yes, you have to use the medicine properly, and that's why it is prescription and not over the counter. If you overuse some asthma medicines, especially a medicine called albuterol, you can actually decrease the sensitivity of your airways to the medicine, and it won't work as well. So basically the rule of thumb is if you're using your asthma inhaler more than once or maybe 2 or 3 times a day, if you're using it every day for more than a couple of weeks, you really need additional medicines, and those would be steroid medicines that can be inhaled to reduce the inflammation in your lungs. So the short answer is yes, but that doesn't mean you shouldn't manage your asthma. You should still use the medicines, but appropriately with the help of your doctor.
I happen to know a couple of asthmatics. I know albuterol, trust me, is a godsend if you suffer from asthma. Okay, our last question comes to us from Mighty. This is from Denise Leon Guerrero. And Denise asks, my child has a chest cold with a lot of coughing. Possibly, could my child have asthma?
Yes, your child could have asthma, Denise. The main thing is that there is a variant called cough variant asthma where the child doesn't wheeze, they just keep coughing. Right now on Guam we have a little bit of whooping cough going around too, so that would be another consideration. But if you hear any wheezing, or your child especially is feeling very short of breath, or you're noticing that they're having trouble with their breathing, please get them seen.
Okay, well, doctor, thank you as always for your insight. We look forward to seeing you again next Tuesday.
Thank you very much,
All right,
Jason.
thank you.